Today, we're discussing how to get a luscious jawline and also hand rejuvenation. Hello TLCers. Okay, so first things first, let's talk about the jawline and how we can improve that. I'm sure you can guess what I'm going to say by now. We're going to use a combination of different sorts of injectables, and then we are going to have a look at someone's hands to see how we can improve signs of aging in the backs of the hands. Going over to our patient, you can see that she just has this sort of dimple here on each side next to the chin. And that is just unfortunately one of those things that happens as we get older. The shape of your face changes and you will see that you get a bit more of a jowl here. So they're sort of related to each other. So people often come in and say, oh, I don't like my jowl, this bit here, but the jowl is caused by multiple different things. And one of the reasons why your jowl looks worse is because this area here becomes a little bit more concave. So we're going to improve that today. We're also going to add a bit of volume here because you can see there's just a bit of asymmetry and there's some volume loss next to the nose as well. You can see that. I mean, overall, she looks pretty great, but I can just see that there's a bit of room for improvement in the middle third of the face and in the jawline specifically. So let's go ahead and do that. So the first thing that we're going to do is use some Botox in the lower part of the face. Here we're treating a couple of muscles in the chin and in the jawline to stop this muscle pull from making the jawline less sharp. The next thing that we're doing is using some Radiesse along the jawline to the angle of the jaw with a cannula. So we're straightening up the whole thing right the way from the back to the front. Radiesse is an interesting product. I'm sure if you've seen the channel before, we've spoken about it. It's not a hyaluronic acid dermal filler. It's made of calcium hydroxylapatite, which is a different component. And this one, it gives you more lift than using hyaluronic acid does, and it also helps to give a crisper jawline. So sometimes when you use a hyaluronic acid, it can look a little bit boggy along the jawline, but you don't get that issue with Radiesse. The downsides of using Radiesse are there's initially more swelling immediately after the patient's had the procedure, and you can't dissolve it. So it's not for use in any kind of high risk areas like the lip or underneath the eye. You have to be pretty sure that both you and your patient know what you're getting into before you use Radiesse. So we're using Radiesse here. Now we're going along the jawline, pointing towards the chin. Again, using a cannula. That's just to blend the jowl in with the point of the chin, just to make it look stronger. And here you can see that we're using a dermal filler with a cannula to the base of the nose. So nose to mouth lines, let's just talk about that for a second. A lot of people, when they first come into the clinic, say, I want to fill this, I want to fill my nose to mouth line. And the problem is, if you just fill that, it will look a bugger. It really will not look good because you will look heavier. So you have to treat the cause, right? So the cause is facial deflation. So we treat the areas where you've lost the volume from in the face, and that's normally from the cheek. But you can also lose volume just right beneath the nose. So the hole that your nose sits on in the skull, it gets bigger and your nose falls back against the soft tissue of the nose falls back against this ever widening hole as we age, and that makes your nose to mouth line worse. So one of the ways to improve the facial contour is by injecting this area here right underneath the nose. Now, I won't lie, it's not a particularly nice area to have injected. It is a little bit sore, but it does make a big difference. The next thing that we're going to do is use some Profilo in the neck. We've already spoken about Profilo before. It's a type of hyaluronic acid that when you inject it, it spreads out underneath the skin, and it's used as a biostimulator, not as a filler. So she will look today like she's got a lot of bumps on her neck afterwards, and that will be gone after about 12 to 24 hours. Normally with Profilo, you do maybe 2 treatment sessions for a nice result. Okay, so let's have a look at her before and afters now. You can see that the contour of her cheek is greatly improved in the afters. She doesn't have as much shadowing like here next to the nose, so the nose to mouth line is improved afterwards too. She still does have a bit of shadowing right underneath the cheek, which is exactly what you want. So as I've said before, people often say, if I fill this area here, is it going to look like I haven't got any cheekbones anymore? I don't want a fat face. Well, yeah, she hasn't got a fat face. She's got a lovely smooth contour there, and she still does have a bit of shadow underneath the cheekbone, but in the right way. That's what it's all about, guys. You have to do it in the right way. The next thing that is improved is this little divot that she's got here on either side. I mean, you know, she still has a little bit of one to an extent. Probably if we saw her again, we can improve that further, but I think she's got a nice improvement there. So let's talk about hands now. So hands are an area that I think a lot of people don't realize that we can treat. So, you know, as we age, we lose volume and fat in every part of the body, including on the backs of the hands, and they can look quite skeletal, so you can see all the tendons and the veins coming through because there's not as much fat in there as there used to be. So one of the things that we can do is use dermal filler in the back of the hands to disguise that. Let's take a look. You can see here we're using some dermal filler with a cannula, and we're going quite deep here, just laying down a thin layer of hyaluronic acid underneath the skin to give some general support. The next thing that we're going to do is layer that. So I'm using some more superficial dermal filler over the top of that to give some direct improvement on the quality of the tissue. If you're having hand treatment done and your hands are not in the best state and you have quite a bit done in one go, you would probably get some bruising on the back of the hands, but thankfully it's not as easy to see on the back of the hand as it is on the face. Unfortunately, we haven't seen her again yet for the after pictures of her hands, but as soon as she comes in, I will let you know. Okay guys, that's it for this week. I hope you enjoyed the video. If you have had any hand treatment yourself before and you'd like to let me know what you thought about it, please just add a comment in the comment sections below. In the meantime, don't forget to like, comment and subscribe.